Hi, everyone. Thank you so much for inviting us to talk to you about our project, Get Connected, and share with you the tailored web-based technology we've developed for young men who have sex with men in Southeast Michigan. Before I get started talking a little bit more about the project, I just wanted to give you a bit of background about the relationship that we've developed with the University of Michigan School of Public Health, particularly the Sex Lab, and the development of our community-based participatory research relationship. We have been working together since 2009, when HARC, the HIV/AIDS Resource Center, which is a community-based AIDS service organization based in Ypsilanti, serving 4 counties in Michigan, we were funded to provide HIV counseling and testing services by the Michigan Department of Community Health, and they were very much promoting an intervention known as social networking strategy. And we were really struggling with incorporating this intervention into our services. It was particularly focused on young men who have sex with men, with the idea that we were going to be tapping into the networks of those young men to help get the word out about HIV testing and bring more people from that population in for testing services. And like I said, it was really a struggle for us. And as often happens when community-based organizations receive state and federal funds, we're told what interventions to use in our communities. And we don't have the resources or the expertise often to make sure that those interventions are going to be effective and are going to work in our communities. And that's what we were struggling with. And so when Jose and another researcher from the School of Information at the University of Michigan and we all got together and we started talking about this challenge, we put together a plan to help us get data from our local community, from young men who have sex with men who we were trying to reach, to help us really evaluate this intervention. And that is really what started a relationship that is now going into its 5th year and has developed into more and more projects, including Get Connected. So as we started in 2009 collecting information and data from young men who have sex with men in our county and in our communities, we started with a young men's study that was a pilot study funded by the University of Michigan. And then later on, got more funding to develop a program called UHIP, which I'll talk about in a little while. But as we got more information about the population that we were trying to reach, we saw that while we were focused originally in Washtenaw County, there were a lot of young men who have sex with men that were moving between geographic areas. And so as we thought about future interventions and future services, we really have expanded to include a focus on Southeast Michigan. And there are a lot of reasons for that, not only because of what we found in terms of young men who have sex with men traveling back and forth between different geographic areas, but also because 75% of Michigan's HIV/AIDS cases are concentrated in Southeast Michigan. And 60% of those are among men who have sex with men. In addition, more than 25% of all HIV cases in Michigan are among young men who have sex with men between the ages of 19 and 29. And looking at sexually transmitted infections, if we look at Southeast Michigan, 6 of the 9 counties included in that geographic area have the majority of new chlamydia cases, gonorrhea, and syphilis cases. And in addition, adolescent and young men carry nearly 80% of the burden of syphilis. So in thinking about Get Connected and in starting our project, a couple of things that we used. One was an adaptation of the Project Connect Health Systems intervention, which really was for adolescent heterosexual populations, but showing that many sexually active adolescents in urban areas might have lots of reproductive health, sexual health services available, but don't necessarily use them. We also, from our previous data, acknowledge the need to really address the structural barriers affecting the ability to reach and provide services to young men who have sex with men, both around HIV and sexually transmitted infections. And of course, we used our CBPR approach which was informed by some of the previous work that we'd done, both through the Young Men's Study and UHIP, which was funded by the MAC AIDS Fund. And this is a website for the Sex Lab where you can find more information about our projects and research findings. So just talking a little bit about principles of community-based participatory research, one of the reasons I'm so happy to be here is because I represent a community partner. And those of you who work in community-based organizations know that we are often approached by researchers to have access to our clients, to our community, to participate in research, yet oftentimes our communities and our organizations see little of the benefit. And so really, CBPR is a way to equalize the playing field, so to speak. Certainly it recognizes the community as a unit of identity. It builds on the strengths and resources within the community. And I think for us as community-based providers, we sometimes are reluctant to acknowledge or toot our own horns when it comes to the level of expertise that we can provide. And that has to be recognized in the research process. It also facilitates a collaborative and equitable involvement of all the partners in all phases of the research. And I think that we certainly have learned a lot through our work together. We've been involved in everything from designing the intervention, the study tools, to helping to think about coding of data. And we've learned a lot along the process, and not just me as the director of the organization, but many staff that have been involved. And of course, it integrates knowledge and intervention for mutual benefit of all partners. So really thinking about how we can use the research and the information that we're gathering to improve our services to have an impact in our community. As I mentioned, our staff have really benefited from this process as well. So it's all about co-learning and empowering, and really kind of making that a concerted effort so that it's not just, oh, here's the research, here's the data that we have, but really helping us think about how to use that data for improving services, for future funding, and how to share that at a community-wide level. It's a cyclical and iterative process. We certainly go back to data that we've collected years ago to continue to use that and build upon. And what we learn in one research project helps us kind of continue to identify new areas of learning. And addressing health from both positive and ecological perspectives, particularly in our UHIP study, we wanted to look at structural barriers affecting HIV vulnerability among young men who have sex with men. But we also were very conscious of highlighting the protective factors as well. Disseminating findings and knowledge gained to all partners, that's been a big part of what we've done by coming to share our project and information with organizations and conferences. But it's also given HARC, as a community-based organization, an opportunity to showcase its work on a national and even international scale. And certainly it involves a long-term commitment. As I said, we've been working for 5 years together, and it's a challenge at times because people's workloads change, and this certainly requires a lot of time, but we've developed relationships, and I think we're really in it for the long haul. So putting CBPR into practice, again, focusing on addressing the vulnerability, the structural vulnerability among young men who have sex with men, particularly in the African American and Latino community, and also using the data by the community to advocate for change. So, for example, going back to the original example I gave, we used the data from our first study to go back to the state and say, you know what, this social networking strategy might work well in some other big cities, but we're finding that it really doesn't work so well in our community, and we'd like to tweak it a bit, and this is how we're going to do it. And we have the data based from our local community that supports this. And certainly directing and improving the research, so adequate research formulation, data collection, and dissemination. This is a map that shows the location of HIV STI sites by prevalence in Southeast Michigan. And you can see the red dots indicate the HIV and STI sites. And keep in mind that these sites include both community-based organizations like ours, HARC, but it also includes county health departments and other clinics. So through Get Connected, we wanted to really address some of the barriers to HIV services that we've learned of from previous research, particularly as it relates to HIV testing and STI testing. And some of the things that we've found are the particular challenges that Black and Latino young men who have sex with men have in accessing those services, the cost related to those services. Community-based organizations and county health departments often offer free HIV testing, but that's not the case with STI testing. Also, transportation and location of services. While that map might have looked like there were a lot of HIV testing sites, there are still many that have to travel a long way to find an HIV testing site that meets their particular needs. Certainly addressing age-related barriers. We're looking at a younger population and the ability to serve a younger population, one that addresses beliefs and risk perceptions, that has cultural competency and provider credibility. There's medical mistrust that needs to be addressed, as well as the challenge of navigating services. Too many times our services are separated and in silos, and how we can help young men who have sex with men navigate those services, as well as addressing discrimination. And so Get Connected brought together a variety of groups using the CBPR principles. We had, obviously, the Sex Lab as the research arm at the University of Michigan. We also had the Center for Health and Communications Research at the University of Michigan, which had the technology expertise. We had a Community Advisory Board, which is the CAB, and that was made up of service providers, people who were directly experienced in providing HIV counseling and testing and STI testing services in Southeast Michigan. And we had a youth advisory board, which was really important, helping to tailor the messages and tailor the site that you'll see soon. And also we had secret shoppers. So part of what we developed was a tool to help us assess how these sites were doing as far as addressing some of those structural barriers for young men who have sex with men. And we actually had 2 secret shoppers per site go through the process of HIV and STI testing to rate or evaluate the sites based on the criteria. And some of the criteria included things like the structural characteristics. So what kind of days is the clinic open or hours? Can you walk in? Is it close to public transportation? How long will it take? So if I only have half an hour, can I go in and get an HIV or STI test, or does it take longer? And then, of course, information about insurance and fees. That was very important. And so the raters, when they went in as secret shoppers and went through the process of testing, they were looking at things like, is the site youth friendly? Is it LGBTQ inclusive? Is it sex positive? Is the experience sex positive in terms of the counseling and messages? Is there a focus on goal setting and diversity? And of course, keeping in mind ideal or best practices, confidentiality, interpersonal violence being addressed, explored motivations, and pressure to adopt risk reduction behaviors. So the secret shoppers had a listing of the HIV STI sites, which were based on that map, and they coordinated a calendar. And 2 of the shoppers visited each site at different dates and times, and again, assessed on those different categories. And we had a total of 46 sites that were visited through this process in Southeast Michigan. So Jose's going to come up and talk a little bit more about the eligibility criteria and process.
Thanks, Hima. So to be eligible in the intervention, you had to be a young man who has sex with men between the ages of 15 to 24. You had to be identified as cisgendered male, so the transgender needs are so different that for this purpose we didn't include them. You had to live in Southeast Michigan, and you had to have sex with a male partner in the past 6 months. We wanted to have people who could have been exposed to HIV or an STI. And so we created a randomized controlled trial. And what I want you to see is the red boxes. One intervention has tailored content, and I'll showcase that over lunch, so I'm not going to show you the full site right now so you can play with it on your own, as well as a test locator that includes some of these structural conditions. And the comparison group, the control group, is just getting the test locator. We thought it would be unethical to not give young men a chance to find out where to get tested. Okay, so even though it makes it harder for us scientifically to find a difference between the arms, from a public health and practice perspective, it's the right thing to do. So what is the site tailored on? We decided to tailor it with regards to age, race, ethnicity, sexual identity, history of HIV and STI testing in the past, as well as barriers or challenges that you may have had. Structural struggles, including homelessness, residential instability, discrimination. Who are sources of support in your life, and what do you value, right? And so when you see it over lunch, I'll show you how those things play out. But I can tell you that we ended up getting 130 young men to participate in the study. We had 9 months to build it, test it, and evaluate it. Okay, it's like this is a rapid fire, and over time at rapid fire design. We actually found that both the test locator and the tailored site had very high satisfaction and acceptability by young men. And what's interesting is that we only did a 30-day follow-up, right? We wanted to know, like, are you actually going to go get tested? And a third of our sample actually went to get tested, which is huge if you think about it. We identified 1 previously unknown HIV case, 2 previously unknown STI cases of herpes and chlamydia, which were detected and treated. And we also found that we had 4 HIV positive participants who then went back to their provider, which shows that there is still engagement and retention in care. What's interesting is that we also start seeing decreases in number of partners, decreases of number of sexual risk occasions, as well as some clinically meaningful reductions in barriers, perceived barriers to testing, fears about getting tested, whether or not there was urgency to get tested, as well as confidence to talk to your partner about getting HIV tested or STI tested, or delaying sex until you were able to know each person's status. In moving forward, we're waiting to hear if we're going to get funding for a demonstration project, moving it now from the Southeast Michigan to also include Atlanta Metro and the Minneapolis-St. Paul region, seeing if it works well in different communities. We want to keep using the secret shopper methodology, but move it into a system of Yelp, right? So part of the beauty of our intervention is that it doesn't assume that all sites are as equally comfortable or great in offering services. We want to get more intervention points. We want to reduce the text heaviness of the site to have more video and interactivity. And we want to make sure that it can be downloaded as an app. Again, thinking of the digital divide, we want to make sure that people can use smartphones and not just a tablet or a computer for it. And so in thinking about policy recommendations, I really urge you guys to really think about CBPR as a way of connecting technology and community. I think it can be done effectively. I think you want to make sure that whatever you're building, the community has input into it. And I think it also helps us to think how technology can go back. So once we did the secret shopping, we went back to all the agencies and let them know what had happened and what they could do to improve their services. So technology can also feed back to reality, whatever that might be. And the site, I think, also helps people, and I'll show it to you when you come visit, help understand how they can navigate their services in a more effective way. And I'll stop there, and I just want to acknowledge some of our funders. Thank you.